as you can tell there, we placed a recorder under George Wood's pillow laughing. No, only kidding. Snoring is not necessarily a laughing matter. Not only does it disturb everyone in the household or, say, fellow travellers on an aeroplane, the health risks posed by snoring can have significant impact on a person's overall well-being and on their life expectancy. Now, here to answer all snoring-related queries and to explain how it can be treated is Professor Eve Kamani, a leading ENT surgeon and consultant at the Fitzwilliam Private Clinic. You're very welcome to the programme.
Thank you.
Now, first of all, how do we manage to make this noise? What's happening?
Once we are snoring, we have three kinds of noise, mainly from nose blockage first, the soft palate vibration, which is this one, and the tongue vibration, which is this one. These three noises are usually combined. Not always, but most of cases it's combined together.
Nose blockage, you can understand that someone's got a blocked nose because they have a cold or whatever, or some other symptoms. But why do the other two happen?
Usually they happen after 40 years old, mainly on men, because of the lack of hormones, and then there is the tissue are thicker and longer than usual.
So it's hormone depletion in men that causes the snoring to happen.
Yes.
And what about women?
When it's later, it's about 50 years old, after menopause. So
and they have the same kind
problem
of conditions?
after, but 10 years later.
Can you tell whether there's some underlying other cause, though, than simply age?
Yes, there is also smoking. When someone is smoking, the tissue are thicker and larger than usual. And on smoking patients, we can see the snoring appearing 10 years before the non-smoking patients.
Alcohol. Does alcohol play a part if you've had a lot to drink?
Exactly. If you have a birthday party and you drink too much, then after this, the night following, you are snoring much more. Why? Because there is a tongue relaxation during the night. And that's cause of snoring during the night.
Your tongue relaxes?
Yes.
Do you only snore if you're lying on your back? And I mean, if you're sleeping with somebody and you just nudge them and they turn over onto their side, will the snoring stop?
Not always, because you're not always snoring on your back. You snore more on your back than on your side, but you can snore also on your side and on your tummy. The main reason is that we have three noises causing snoring, and the noise causing snoring when you are on your back is the tongue vibration, this one, which is different than the soft palate vibration. This one is, you can snore on all positions.
No matter what position you're in,
exactly.
If you are prone to make this particular noise. How disturbing is snoring? Because I remember years ago I was staying in a place in I think it was in Denmark, and every second day they arrived to take the glass away from the apartment block, and the noise at 5 o'clock in the morning was incredible. But after the second week, I didn't hear the noise anymore. I slept through it. So why are people continually disturbed by their partner's snoring? Surely they'll just get used to it.
Not always. It's also because the noise is very loud in some cases. It can be 90 decibels, and that's a very loud noise. And when someone is very tired, he snores more. When he is just deeply asleep with alcohol, he also snores more. That's the reason if you have also a cold, then he has a nose blockage. Then you have three kinds of obstruction in the nose, on the soft palate, and on the tongue.
Now, the treatment for snoring, I mean, is there a simple treatment? For example, I've heard that you can stick one of those things that some athletes use to open up their nose to get more oxygen in when they're sprinting.
That's it, but it's not. It's fine for the entrance of the nose, not for the inside of the nose. Inside of the nose, there is some tissue swollen, enlarged, called the turbinates, and that tissue are mainly on smoking people. People who are smoking. And when this is surroundings, these tissue are swollen and bigger than usual. So then if we don't remove a part of this tissue, the people keep snoring during the night.
Are people who are overweight more likely to snore than those who are normal weight?
Exactly, that's true. When you are overweight, you gain weight also in your tongue. If you lose weight, for example, 5 kilograms in your body, you will lose 5 grams in the tongue. Then you reduce the size of the tongue, and then you snore much less.
So when you slim on a diet or whatever, your tongue is getting slimmer as well?
Exactly, as well.
Okay, so that's one simple remedy. How do you know, though, what the reason for your snoring might be? Because there may be an underlying health condition.
Exactly. That's also can cause some disease. Some snoring patient can have sleep apnea syndrome. That means that they stop breathing during the night too much, and then they get sleepy during the day. So they have sleepiness, tiredness, and they feel headache in the morning. So this patient can have also high blood pressure and heart disease like strokes, myocardial infarction.
Now, when you've got sleep apnea, the heart is actually, or the breathing is stopping.
Exactly.
Now, does it always start again?
Yeah, usually yes.
I mean, otherwise you've got a dead body.
Exactly.
But you know what I mean? Do people die from sleep apnea?
Yes, that can happen.
That it never starts again?
Exactly, that can happen. That's cause a myocardial infarction, and then you can die from your sleep apnea. But usually the patient can breathe again. And the problem is that you have a lack of oxygen for your brain and for your heart. So that can lead also to Alzheimer's disease if you have too much lack of oxygen to your brain.
If someone is snoring beside you and you just give them a thump, does that work?
Only for a few minutes. And then he goes back snoring again.
What impact does snoring have on relationships? I mean, when people come to you for advice on snoring and maybe some therapy, what do they tell you about what's happening in their private lives?
Usually they just don't sleep anymore in the same bed as their partner, so they close to be divorced, and they want just to have a cure, to have a treatment. So that's the problem. They ask for treatment because sometimes they are very distressed about this problem.
Do people know themselves that they're actually snoring?
That's the problem. Most of snorers don't know that they are snoring.
I mean, is it possible that you'd be woken up by your own snoring if it's very loud?
Only it's very loud. Not it's if it's less than 40 decibel, you can't hear your own snoring.
If it's less than 40 decibel.
Yes.
But some snoring is extremely loud. So you could actually be waking yourself up if you have a bad case
exactly.
of
If it's 60 or
snoring.
70 decibel, you can be waking.
Now, what about people who are embarrassed by their snoring? For example, maybe if they've sleep apnea and they're falling asleep during the day, they might be falling asleep on the Dart or on the Lewis or on the bus.
That's it.
And they're snoring loudly.
And that also can cause a car accident because they can also be sleeping on the wheel of the car.
Because they're suffering from sleep deprivation, really.
Exactly.
They haven't had enough rest. Lifestyle changes. We've mentioned overweight and we've mentioned smoking. Are there other things that, like, for example, if you went for a jog for half an hour before bedtime, would that help you to stop snoring?
No, because that doesn't change any at all the airway and the airflow through the airways and the throat.
It won't change anything?
No. If the snoring is coming from the soft palate, which is this noise, this is the loudest noise usually, this noise can be treated by the laser also, and we can remove completely the noise with in about 15 minutes time with a laser technique by removing the small part of the soft palate and the uvula. And also painless during the operation.
And afterwards, when you're missing a bit of your soft palate, is it sore?
Yes, it's sore. About 5 hours later, it starts to be sore, like a sore throat pain, a swallowing pain for 10 days. So the patient can have a strong painkiller to stop it. Yeah. He can work as usual, he can speak as usual, he can swallow as usual, but he can go back to work immediately after.
All right. And that's simple to do and very short because it's done under local anaesthetic.
Exactly.
And after 10 days, you're absolutely perfect. And is there a guarantee you won't snore?
So you can't snore anymore from the soft palate, but there is a third one, which is the tongue vibration. And this one is more difficult to treat. The third one is not always present, only on a patient with an overbite. It means that the lower teeth are too much behind the upper teeth, or if there is a patient very overweight or obese, then the tongue can also be involved in the snoring. So
what can you do to the tongue?
So the tongue, we can just advance the tongue with a splint, advancement splint. Just we can buy it in a pharmacy or in a dentist office, and just it's a way to push forward the tongue to prevent the tongue to go vibrating to the back of the throat.
So you put this in every night as you go to bed, and it should prevent the vibration
of the tongue.
Is it uncomfortable to wear them?
No, it depends. If it's fitting well with a dentist print, then it's easier to tolerate.
Now, are there techniques other than those laser techniques and the splint technique that might help people that they could try themselves before they resort to the GP and then to a consultant like yourself?
Usually not. There is most of the technique don't work. Apart from this technique, you can have if you have a severe sleep apnea syndrome, you can have a mask on the face, on the nose for all the nights. And then you stop breathing all the time, and you are very obese. Then this mask can be a way to stop to treat the sleep apnea syndrome.
Now, there was a company in Ireland that brought out a ring that you put on your little finger, which was to press on a pressure point, an acupressure point, and many people said that worked very well.
Yes, but in my experience, the problem is that there is an obstruction, and if we don't treat the obstruction, the patient still has some abrasion. So that's the problem. Usually it's only a question of treating or not the obstruction of the airways.
Now, if you don't have sleep apnea and you're just snoring, you're vibrating and so on, and you move rooms so that you're sleeping on your own and no one hears you, does it do you any harm at all to be snoring?
Yes, because snoring is the beginning of sleep apnea. So if you treat the snoring, you prevent to have sleep apnea later. So it's a way also to treat yourself, to have a better way of life, because you just have you exercise much better, easier, you have more oxygen supply for your brain and for your heart, and you feel much better, more energy during the day.
This one says, my lady snores like it's going out of fashion. I purse my lips and make a high-pitched squelch sound. She stops straight away. It never fails. Patent is pending. That's from Finbar in Cork. He obviously frightens her in her sleep, makes a strange noise.
Exactly.
So she stops until they get some. Swimming daily laps will improve breathing and reduce sleep apnea significantly. That's John says that.
No, it's only swimming. It's only washing and cleaning the airways, mainly for the nose. And when someone has a nose blockage, that's something to help the snoring when we are snoring for the nose.
If you deal with the snoring problem earlier, is that does it lead to a better result?
Exactly. If you treat it earlier, you have also much chance to get sleep apnea syndrome, and you feel much more energy, and more concentration, more memory after the operation.
Now, can everyone be cured of snoring finally?
Everyone, no, not always, because if you have a severe bite, then you need to have the mandibular adjacent split for the throat, and it's not always easier to tolerate from the dentist.
But most people can.
Most of them, yes.
All right, on that note, on that very positive note, Professor Yves Kamani, a leading ENT surgeon and consultant at the Fitzwilliam Private Clinic, thank you very much for joining us.